Hello and good evening. This is Kuldeep Chaudhary from Health in India. I'm here at AG Knee Clinic. We'll be talking to one of the most renowned knee replacement surgeons that India has produced, Dr. Ashok Goel, who after getting trained and working in United Kingdom came back to India in the year 2008 to serve Indian people. Dr. Ashok Goel, who's probably one of the very few FRCS in orthopedics, has a very big specialization in the field of knee replacement. A few years back, knee replacement was not a very popular procedure, but today it has become such a popular procedure. It is being done at more than 70 centers in India, with a large number of international patients flocking to India because of the very attractive prices. In India, you can get a knee replacement surgery done for about $12,000, that too for both the knees, while in the same procedure in the United States of America costs in excess of $150,000. The expertise, the experience, and the volume of work that the Indian doctors are doing is bringing in such amazing results. Today, doctors like Ashok Goel have scores and scores of satisfied patients. Patients who had lost hope are today jogging, running, doing all sorts of activities. Still, there's a lack of information, there's a lack of understanding about what exactly this procedure is. So let us talk to Dr. Ashok Goel and try to understand what exactly is a knee replacement procedure. Good evening, Dr. Goel. What I would like to know is, what exactly is a knee replacement surgery?
Mr. Chaudhary, I'd like to tell you about, with the help of the models. This exactly is the model of a knee replacement, and it shows two joints, which is the femur, the thigh bone, the tibia, the shin bone, and this is the kneecap, the patella. Now the knee basically is a hinge joint. It moves like a hinge of a door with minimal rotation. And what happens in arthritis is there is wear and tear of the articular cartilage, meaning thereby that the smooth layer is lost and the surfaces become rough. Similar to what I'll be showing in this model here, that's where the articular surfaces become rough. Instead of being smooth, they are roughened, and when two rough surfaces rub against each other, it hurts, and also the mobility is reduced considerably.
So Dr. Goel, you explained that a knee is a hinge joint. I believe the first knee replacement implants were actually designed on the basis, on the formula of a hinge joint. So what developments have taken place in the implants that are available now?
The implants that are available now, obviously a lot of technology has gone into it. The material of the implant has improved, thereby the cobalt chrome steel. We've got these oxygen knees, and also the insert, what we call the plastic. That's this bit of plastic that the insert that we put in is highly cross-linked polyethylene, and also we've got E polymers that is being inserted in vitamin E so that the oxygen-free radical is reduced, and it increases the longevity of the prosthesis. Also, the implants have become more specific, conforming to the contour. They have become more site-specific in the form that the longevity of the implant is improved. And also we've got the cement, the life of the cement is longer. We've added gentamicin into it. The infection rate is considerably reduced. And we can easily expect the life of a properly done knee to be 20+ years.
Dr. Goel, a few years back there was a very renowned surgery done on a former Indian Prime Minister, and I've heard from several knee joint surgeons that that was probably a big disservice to this procedure, and when his recovery was not as good as expected, this procedure was pushed behind by almost 5 to 10 years. Today we see a large number of common people going for this procedure. So what normally is the mistake that a surgeon can commit in doing this procedure?
I mean, yes, we are all aware of the surgery being performed by the Prime Minister of India and by one of the most renowned surgeons in the world with an excellent track record. It was unfortunate, but I think it's very important that the surgeon performing the surgery has to work the patient himself, know in details the history, the examination, the expectations of the patients, and also detailed history to find about the comorbidity conditions. because they influence the outcome of the results, and also there should be adequate time to recover, and you must have time to perform the procedures yourself under your supervision should the physiotherapy and the recovery period be.
So Dr. Goel, we know that arthritis, you just explained arthritis, destroys your knee and once it is replaced. So can this be done on every person who's suffering from arthritis, or there is some selection criteria?
Yes, we need to know, obviously we have to assess the patient, we need to know about the status of the circulation, the comorbid conditions, they need to be controlled, because surgery, any surgery is a stress, and obviously knee replacement is a stress when you need to have the general conditions as such, the lungs, the heart functioning well. If it's diabetic, it has to be well controlled. And I'm very particular about patients with renal problems, renal failures. They are the patients I try to avoid doing knee surgeries. And obviously, if they have to have a dialysis to get the urea creatinine level well within control, reasons the chance of infection increases. And with surgeries, obviously, does affect the kidney because of the dust particles, the fat globules, goes and affects the lungs, the heart, and also the circulation to your kidneys. So yes, we need to idealize the patient to make sure that he is or she is at the fittest best.
So you mean to say, from a surgical perspective, if the patient is fit for any kind of surgery, then a knee surgery can be performed. But what about the condition of the knee? At what stage would you say that this is a fit case for replacement?
Well, I think, Mr. Chaudhary, that's a very important and valid question. Yes, if it depends that obviously the advances are that we can do an arthroscopy, we can arthroscope debride the joint, we can smoothen the articular cartilage. That's one, that's the early stages. We've obviously in medical terms graded arthritis into various stages depending on the severity. One being the mildest, in which there is just fibrillations of the articular cartilage. 4 being the severest form, in which the articular cartilage is lost and the bone is exposed. As you find the red part here, the cartilage is exposed and that causes pain. In that cases, yes, we go for replacements. However, if we have a isolated patch around 1 or 2 centimeters diameter, in those cases we do for chondroplasty or cartilage transplants. That's very successful. In cases which I do quite a lot of these is what we call as a unicondylar half a knee replacement. In these cases, there are strict criteria. A, the cruciate ligament, it has to be intact because we do not want the back of the cartilage to involve. It is done on the outside. Also, the success rate is not as well documented. We need the longevity of the prosthesis and the patients. However, if the inside of the joint is affected, I call this the inside because that's the thin bone. We call the fibula on the outside. That's the inside. And again, we find that the articular cartilage is affected. That's the femur bone. So all we do basically is just remove a sliver of the bone here, a sliver of the bone here, and that's just like resurfacing it. Once that's been removed, we do is we just put these 2 inserts here. We put them in this pattern here, cement this, uncemented available also. We put this in this pattern here, yeah, and then all we need to do is just insert a plastic. I'll just push it there. The articular cartilage is restored. Now there's nothing like your original joint, and this is the best, it's least restrictive joint, restores your mobility, and you can go do sports, you can do mountain hiking, you can play tennis, swimming with absolutely no problem at all. So that's basically what we call as a unicondylar or a partial knee replacement.
So basically what you are trying to say is that the moment an arthritic patient starts having basic problems or initial problems, he or she should consult an orthopedic surgeon, so the problem can be addressed at an early stage and it would be lesser invasive.
Yes, definitely, because obviously surgery is the last resort. First of all, you should try physical therapy, you should try drugs, and you should try lifestyle modifications. In these modifications, obviously, if you're overweight is a major problem now. You tell the people that you must reduce weight because the weight transfer on the joint is reduced, the longevity of the joint is increased. Then we ask the persons to take analgesics. Analgesics, take them off and on. They work. If not, change on to another one. But the analgesics should be taken under medical supervision. Do not buy it routinely over the counter. Reasons: they affect your kidneys, they tend to affect your heart, and also people tend to develop I won't say resistance, but they tend not to, the efficacy of the drug may reduce. In that case, it's best to be done under medical supervision. The lifestyle modification is you alter your footwear, because the shoes that you modify that will reduce the impact on the joint, similar to like, I drop this joint on a hard surface, or I joint it say on a soft surface on my thigh, then the impact reduces and the longevity of the joint increases. That's one. Then the lifestyle, I'd rather say you go for cross trainer and you go for prolonged walking instead of using a jogger or jogging on the roads, where some people you find running on the roads, that tends to worsen the joint implant. And then besides the analgesics, you can use the walking aids, they do help. Once all these non-operative interventions have been exhausted, surgery becomes the last resort, because there's no coming back from what's bad surgery.
So we had Dr. Goel answering our questions quite in detail about what is a knee replacement surgery, from his credentials, from the work that he's already done in India in the last 4 years and more than a decade in the United Kingdom. I, Kuldeep Chaudhary from Health in India, can confidently say that you can trust your knees with Dr. Ashok Goel. Thank you and good night.